So what you have to do is you have to tweak the message to fit the person. So I'll ask people things like, so you like black eyed peas, you like cornbread, you like greens. Would the world end if you just ate the greens and the black eyed peas without the cornbread? Now, of course, initially they think it would end, but then I say try it, see how it goes, and if you get rid of that one thing, can you eat some ribs without barbecue sauce? You know, would you be willing to spend more time on the planet with your family if you could actually still eat ribs, but you're not doing barbecue sauce? And so what you do is you give a compelling argument. And are they having that conversation with any clinician? And the answer is probably not. They're only focused on medications, surgeries, procedures, which is how me and Dr. Baker were trained. And so they're not bad doctors. They just had not gotten off the hamster wheel long enough to see the world through a different lens.
Dr. Hampton, it is a pleasure to have you back. Welcome. Thanks for returning. And it's good to see you continuing the good fight. I see you on social media doing the right things. And so it's wonderful to see that. If for those that aren't familiar with you, would you just briefly reintroduce yourself?
Yeah, I'm in Chicago. I work for a health system called Advocate Aurora. And so we're in Wisconsin and Illinois. I'm a family doctor, extra training in obesity. Wrote a book, Fix Your Diet, Fix Your Diabetes, for my patients who struggled. I didn't have time in the clinic to educate them, so I had to write a book. And now I'm hanging out with people like Dr. Baker on social media, fussing at people about the benefits of carb restriction, keto, and carnivore. All this stuff started when my wife got type 1 diabetes, and it led me down this path of trying to better understand how can I help her. She's a pharmacist, didn't want to be on a lot of medicine. And I was like, man, what can I do? And then I learned that the let food be thy medicine was the answer. I don't know why they didn't tell us that in medical school, other than, a few quotes from Hippocrates. It's like, can we follow what the man says, And since then, my life has changed tremendously, because not only did I help my wife, myself, and my kids, even my kids, their grades are off the charts. They're at WashU in St. Louis, and they're killing it because they intermittently fast. They eat, they kind of do a keto thing, and they're killing it. So it's been really eye opening. I'm kind of a pseudo carnivore. I'll probably have steak for lunch. I may have one vegetable for dinner. So I'm kind of almost there. But I just do better. I feel better when I eat animals. I just feel better. So I just, I'm stuck. I literally probably am still stuck eating vegetables, because part of my brain is eat some vegetables. But I feel better when I avoid plants. So it's been awesome. Recently, I was one of the commentators on the documentary Beyond Impossible. So I had a chance to, add some thoughts to that. And it's been wonderful, guys. I literally live for this. I could see this being a full-time job, just educating the public and reaching more people, because so many people are not going to get the message. And we just want to make sure they hear that message. So thanks for the opportunity to spend some time with you guys today.
Yeah, I did. I just actually did a podcast with Vinny the other day. Vinny, who created the film Beyond Impossible, and I saw you. And it was great. I thought it was a great movie to get some of the message out there. What was your motivation for wanting to be in that film? And it looks like you used to be a vegetarian at one point. So what?
Man, yeah, I was definitely a vegetarian, and it's mostly, I was just like everybody else, game changers. I actually had a patient just yesterday who was like, doctor, you're going to be proud of me. I'm doing much better. I saw game changers, and I'm like, I'm having chest pain, just hearing it. So part of it was, I knew when I heard Vinny was doing it, and I was impressed with his previous documentaries, Fat the documentary 1 and 2. We needed more voices. And I think What the Health, Forks Over Knives, all of those types of documentaries, there needs to be balance. And we need people who are messaging that there's another way. So I was inspired to be part of that. Also was inspired to message that fat's not going to kill you. Now things are better. And I remember sharing probably my most popular tweet was a tweet that announced that the American Heart Association is saying, you can do a low carb or a very low carb diet, thankfully. But we also had the Society of Clinical Endocrinology say it. I think they said it back in 2016. The American Diabetes Association said it, and at the end of 2019. So what I wanted to do is be one of the voices that could share that message, and also, and I shared this with Vinny. Me and Vinny have a lot in common because we have roots in New Orleans. I went to Xavier, New Orleans. He spent a lot of time down there, and I said we also need to diversify the voice. And if you go into, and you notice, Vinny, if you go into the low carb community, you don't see a lot of people of color who are, Black Carnivore, of course, talks about carnivore, but not a lot of people of color talking about carnivore, keto, low carb. And I just wanted to be one of those voices. So I thought maybe that would be a way to kind of grow that exposure so that some people are on the fence. If they see somebody that looks like themselves, they're more likely to maybe engage. And I just wanted to make sure that people saw some of who looks like them. So I that's why I appreciate Vinny. I think Vinny. I appreciate Shawn just giving us some exposure so that people can say, oh yeah, there's somebody that maybe I may listen to that guy. And I think so. That's the main stuff I wanted to achieve by being on a documentary.
Yeah, and that's a good point, Tony. And why do you think it is that we don't see as many people in that in the Black community? There's a lot of veganism that's being promoted in there, and we're seeing people adopting that. But what do you think? Why do you think that is?
Well, I think most of it is what you just said. Just like that patient I had, that patient shows up and they are trying to do what's right. And unfortunately, I remember when my kids were little, and as a doctor who wants to have healthy babies, I think anybody that's been a parent, everything changes when you have a kid, right? So I started Googling just like my patients do. And what happens is, I remember the book, it was called How to Disease Proof Your Child. I think it was by Dr. Esselstyn, right? So I started, and then once you start, you fall into that little rabbit hole. And even for you guys who are more carnivore, right? You don't want to get into a rabbit hole. You always second guess everything. When Dr. Baker starts to get the research out, you question everything, even if you're kind of indoctrinated. I was a vegetarian for 8 years. And everything I heard was really, it's almost like if you watch Fox News, right? Everything is Fox News. And then if I watch MSNBC, everything is in it, so you have to get out of that. You need to see, before Rush Limbaugh passed, listen to him one day and listen to Clarence, listen to Al Sharpton the next day. Just get completely contrasting views. And that way you'll better be able to use your freaking brain and then say, okay, I hear what they're saying. What's the science? What's the evidence? So, but in the communities of color, and one more thing I'll mention, I remember when I was trying to convince my patients to, eat vegetarian back in the day. And I remember Dr. Michael Clapper, one of the vegan guys, he had a video and it showed all that sludge in a test tube from a patient whose blood he drew. And it was so compelling to show that video to patients and say, look, you don't want to eat a hamburger because it's going to clog your arteries. I had not done any research on, verifying what he was saying. I was just indoctrinated into that way of thinking. Lo and behold, you do the research and find that actually, if you eat fatty food, you're going to use it for fuel. And it may be cloudy for a minute, but you're going to consume it for fuel. It's not going to sit there and clog your arteries. I did not know that. I didn't understand it. And so for me, I think part of it is, I think, how people get information. The other part is that, again, in communities of color, they need to see somebody that they can relate to. And then the other part is, if you ask people in any community, if you're Italian, I remember interviewing Dr. Bimbo Kikio for my Protecting Your Nest podcast, right? And he's Italian. So how do you tell an Italian not to eat pasta, right? So what you have to do is you have to tweak the message to fit the person. So I'll ask people things like, so you like black eyed peas, you like cornbread, you like greens. Would the world end if you just ate the greens and the black eyed peas without the cornbread? Now, of course, initially they think it would end, but then I say, try it, see how it goes. And if you get rid of that one thing, can you eat some ribs without barbecue sauce? Would you be willing to spend more time on the planet with your family if you could actually still eat ribs, but you're not doing barbecue sauce? And so what you do is you give a compelling argument. And are they having that conversation with any clinician? And the answer is probably not. They're only focused on medications, surgeries, procedures, which is how me and Dr. Baker were trained. And so they're not bad doctors. They just had not gotten off the hamster wheel long enough to see the world through a different lens. And once I got off my hamster wheel, everything opened up. And that's kind of, so I think people, it's various reasons, but I think if you can build rapport with people, some of my best docs in terms of rapport with an African American population, they're not African American. They're doctors who give a damn, excuse my French, and they take the time to explain stuff in simple terms and ask them, would you change one thing? Would you be willing to get rid of the sweet tea? Would you be willing to get rid of the cornbread? Would you be, to be here for your family? So you always ask people, what's your why? My why is that I want to be alive so I can do this stuff I'm 53. I want to be able to do this for the next 40, 50 years. And I can't do it if I'm sick, right? So my why is to have time to have moments like this.
Yeah, Tony, and you're such a great, person explaining things, and you talk about wanting to do this as a full-time job, and I think, when I look at physicians now, and like you, most docs are good guys and gals. They're trying to do the best thing, but they just don't have the tool set to do what we're able to do with getting people off medicines. And I think, we're going to raise the bar where patients are going to expect, I don't just want a pill. I want to actually feel good. I want to actually get my life back. And I think that's going to be where doctors are going to be judged,
Yeah.
in not too distant future. So I think that's awesome. Let me ask you, there's something here about, a lot of people feel it's necessary to adopt low-fat diets. And we look at, are there RCTs? Are there observational studies? Why do you think the belief is we need to be eating, basically a cardboard diet with, our dressing on the side type of thing?
I think it's primarily rooted in the messaging. So let's go back to Fox News and let's go back to MSNBC. So when you get to the commercial breaks, you're going to see, breaking news. If you eat egg yolks, you're going to die from a heart attack. Breaking news. Meat's going to cause cancer. And I remember one of the examples was the bacon question. And it was like, well, if you eat bacon, it's going to increase your risk for colon cancer. And then you look at it and you're like, oh, well, how much does it increase the risk? And then you look at it and it's like, it goes from 5% to 6%. So and then you have to eat at least 4 to 5 pieces of bacon every single day for the rest of your life. So for a lot of people, even carnivores, they're not necessarily eating bacon every day. And even if they did, who gives a crap if it goes from 5 to 6%? But what's messaged in the media is a 20% rise, which you could argue that's not too bad either. So I think it's the difference between how it's messaged. There's no nuance. Nobody's explaining any of this stuff. What's this type of study versus that. And a lot of the information from the past were observational studies where people got food frequency questionnaires or they looked at data. And once we started to get the randomized controlled trials, it was very clear that the saturated fat does not cause heart disease. It was very clear that keto, low carb, and hopefully we'll get more data for carnivore in the very near future, does not harm people. And the one study that I actually reviewed that was more of an observational study, which gives us the opportunity to do more, said that everybody doing carnivore is doing really well. So if the data says people are doing well, what are we afraid of? And I think what we're afraid of is that there's bias out there in the world. And if you think about it, when I wrote Fix Your Diet, Fix Your Diabetes for diabetics, my patients, I was a vegetarian before I started writing. And it was only because I started looking at studies like the SHAI study, SHAI, and they always use the top author and they put their name on studies. I was like, well, I see the low fat, I see the Mediterranean, and I see the low carb. And the low carb was beating the Mediterranean. It was the best diet. So I could not, with my scientific hat on, honor what I was writing if everything I looked up was not matching what Dr. Ornish told me or Dr. Esselstyn was telling me. They were telling me this stuff's going to kill you, but the study said the opposite. So I think for anybody listening to this, it's important that if you see randomized controlled trials, favor that. That's real research. If you don't have randomized controlled trials, it's okay to look at observational studies where they send surveys. But you never take those observational studies and say that's proof. That's only correlation. Maybe there's an association, but do not make life changing decisions based on that. Now, if you don't have enough studies, you can kind of roll with that. And then we get people like Dr. ShawnBaker to do some research, maybe myself, because I do want to do some research myself as well. So,
Yeah, and the one point you bring up about the bacon and or the meat and the colorectal cancer and going from 5% to 6% and 1% absolute increase. It's like, well, what are the other things that lead to cancer? And we know like obesity, you're looking at like 200%, and hyperglycemia, you've got several 100%. So it's like whenever they report on these things, they totally sort of miss the forest for the trees, and they don't tell you, well, this is a overall risk. And all I see is people losing weight and getting leaner by eating.
and in that same study, they put bacon in the same category with smoking. And that's almost an insult to people's intelligence. So you're going to tell me that me eating a few pieces of bacon is like smoking? It's a ridiculous, and it was the difference was so striking. It should have been removed from the discussion altogether.
Now let's talk about since you were in Vinny's movie, do you have patients that want to eat these Impossible Burgers and Beyond Burgers, and what is your thought on the nutritional value of those types of things?
Yeah, I have tons of patients. Again, the people who come in now it's almost like I've had these people for a year or two, right? So you would think they would have gotten the memo. This is a low carb doctor. They should know that, right? But when you're talking in a 15, 20 minute, oh yeah, by the way, Sharon, I love your baby. I just want to say that. So I love babies, by the way. I'm a family doctor. So when I see babies, I have to pause. But yeah, so they come in saying, "Oh, doc, you're gonna be so proud of me. I'm now eating an Impossible Burger. I'm trying to cut back on meat," and it's like they never quite hear that I'm okay with meat. In fact, I'm moving people away from vegetables and into meat. So what I do is I have conversations with when I was thinking about Vinny's movie, when I was thinking about conversations with my patients, I started looking at the labels. And when I started looking at the labels, I saw that things like calories, when you compare an Impossible Burger to a regular burger, they were very similar. Things that really surprise people when I say this, and I have people who have congestive heart failure, high blood pressure. The sodium in a regular burger is negligible. It may be like under 50 grams or something. But an Impossible Burger is 1,200. It's 1,200. So when I say that to patients, they're like, "Oh my God." The protein is a very interesting conversation because many people who are vegetarian, they are eating Impossible Burgers to get more protein because, as you know, a vegan vegetarian diet is not the best source. So but the numbers are similar, but the quality is not the same. So it's just not the same. So but the thing that really struck me when I thought about Vinny's documentary was this, leg hemoglobin, which is something you get from the root of a soy nodule, I think it is, and that particular substance is what makes it taste like a burger. It's what makes it bleed like a burger. And so when I thought about, well, what's the big deal? It's from the root of soy. It's from a vegetable, so what's the big deal? And then all of a sudden, you look at the one study they did, which was, and I think Vinny talks about it in the documentary. It was a 28-day rat study, and in that rat study, they did find there was harm. It affected their blood chemistries. It affected their clotting ability. Some of the labs, like alk phos, we usually do an alk phos. It's automatic when you do a chemistry. And when we do an alk phos, it's really to make sure you don't have any issues with your bone, your intestines, and your liver. Well, those numbers are negatively affected. So, and unfortunately, Impossible Foods, instead of doing a study or the FDA requiring a study on humans, they just basically said, we'll do the experiment on real people. So instead of doing a study, they say, oh, it's okay. And then they put it out there. So I can't say for certain that eating this fake food is going to harm you. But what I can say is that it harmed the rats, and they should have done further. So I think it's just kind of like this experiment, just like that Crisco experiment that we had on us, for years. And you could argue the American Heart Association, it should be maybe a class action lawsuit because they were supporting it, assuming they knew better. But I'm gonna tell you, you can't eat fake food and expect to be healthy when you have real food options. So, and by the way, is it cheaper than real beef? No, it's not. It's probably twice as expensive. So when I talk to patients, I kind of give them that frame of reference. I say, this is what you eat. You're a vegetarian. Periodically you may want to indulge, but if this is considered a health food, that's an absolute no.
Yeah, essentially the soy leg hemoglobin got that we've got this generally recognized as safe designation, and we really have no idea what the long-term implications are going to be for humans at all. And at the very least, it's processed garbage, which we just don't need more of in our diet. And I think
That's right.
that's a shame. Let's talk about protein quality because there's a lot of thought on, you can get, all. We'll hear a lot of the vegan advocates say, well, all protein originates as plants, and so you cut out the middleman and just eat lentils and beans, and you're going to be just fine. Are there any concerns about the protein differences?
Yeah. Well, first of all, I write a monthly column with the diet doctor, and I have this acronym, NEST and ROPE, right? And it has different meanings, but the N is for nutrition. And but I mentioned the diet doctor because they do focus on protein now, right? So they're now focusing on protein because they're finding that there's a lot of benefits. So, and what you'll find, but not from myself or Dr. Baker, but most people, and I'm getting a master's in nutrition, and even those nutrition professionals who they tend to lean vegetarian, they admit that what's the most important macronutrient is protein. So if that's the most important nutrient, then we need to make sure that when we consume protein, that is from a good source. So, and what we find is that the plant-based burgers are, they're okay, but they don't really give you the quality of the protein or amino acids. So what I learned in nutrition school is something called it's like the digestible, indispensable amino acid scale, or DIAS score, right? I had never heard of this because I didn't learn any nutrition in medical school. And what I learned about that is that the higher that score, the more likely you are to have a more absorbed form of protein. So the goal is to have a high score. So you look at these documentaries, like I mentioned, Game Changer, and they'll say, oh, you can get all the protein you can from these plants. But if you look at the average steak or the average serving of 3 eggs or so, you're looking at a score that's over 100. It's like 110, 115. But then you look at things like lentils and peanut butter sandwiches and stuff, and the scores are like 50 or 40. So what that tells you is that, you'd almost have to, like, we watch, my father-in-law has dementia. And one of the things he can watch without, losing focus or getting anxious is the Animal Channel, right? And when you watch this stuff, you're like, you're realizing that, it's an ape, for example, right? So you'll sit there and watch this ape with this big belly, right? And people will say they're just like us. Well, in their head they are, and the way they take care of their babies, going back to Sharon again, they do a really good job of taking care of their babies. They're like us, but if you look at their belly, they eat like 24/7. So if you want to eat 24/7 and act like an ape, go have at it. But the reality is we're more like the lion. And I've learned that that's how our body, we're not cows, we don't graze. So I don't want to have to eat twice as much or 3 times as much to get the same amount of quality protein in my body. That's why. So with my patients, when I'm in the office, I try to like literally look up the DIAS score for food that they're consuming and say, this is probably not going to be enough of the most essential macronutrient that you need.
Yeah, and it's interesting when you look at that DIAS score, it replaced something called the PDCAS, and it's even more accurate. And they saw the plant when they did that, the plant proteins went even worse than what they used to be, and so it's gotten worse for them. And the other thing is Peter Ballestat. You may be familiar with him. He talks about the fact that a lot of the protein that's labeled on nutrition label, particularly plant food, is actually crude nitrogen. So it's not even actual protein, and then so it's overestimated by quite a bit. So we do end up with significant issues with that.
And also, Dr. Baker, when you process the proteins, it reduces your diet score half, even more. So you can argue. So let's just say you get a Impossible Burger and it says 50 grams of protein. You got to cut that in half because it's a plant. Number one. Then you got to cut it in half again because it's processed. So you're walking around thinking, I just ate 50 grams of this Impossible Burger. I'm okay. I'm going to have muscles like Dr. Baker. No, you're not. It's not. You're going to have to eat a whole lot more to get even close to that number.
Yeah, you're gonna have to do some training too, I can tell you that.
That would help.
There are concerns about, even if what we say is true, which I tend to think it is about, superior protein and the fact that meat is not bad for us. But then there's people who are going to say, well, even if we could eat good food like this, we still have the environment to worry about. And cow farts are boiling the ocean and all this type of stuff. What are your thoughts when you hear that sort of argument?
Yeah, I think the first part of this argument about the environment is you got to be just a little logical. And I try to be a scientist, so sometimes logic will hurt you. So when I mentioned how that test tube looked, your brain logically would say it's going to clog your arteries. So you have to be a scientist and then be objective and hear both sides of the argument. So I think for me, I think that people feel good about not eating animals because they think it's good for the environment. They think it's gonna be nice to the animals. But when I heard the CEO of Impossible Burgers, and I think it was in the documentary when I first heard it, he said, he says how he loves cows, but but because they cause so much harm, right, on the environment, that he would eliminate all the cows from the planet. Now, that's a pretty extreme statement. So, and it's just so that's the first thing you want to think about. I learned a lot about this. I think maybe some of you guys are familiar with Diana Rogers' Sacred Cow documentary, and I learned a lot from her. And she's able to kind of parse the fake from the real. And one of the things that became logical is that the cars and the factories, they have to be causing more harm. And so they just have to be, right? And I think Benny in his documentary, he talked about how the cows, it may get in the environment for 10 years, and then but for the automobiles and factories, it lasts for hundreds of years. So that's one thing to think about. But also when I think about Diana Rogers, she talked about, I think she said it was like maybe 2.6% impact on emissions from the cows. She talked a little bit about how water is not impacted greatly because most of the water that the cows use to create them, they're mostly green. It's green water, which is rainwater, versus blue water, which is the water that we use. So, and then she gave examples of how beef is using less water than rice. So those are the types of things that come to mind. And I just think that one thing that I'm going to look at my phone real quick because I remember I live in Illinois, right? So I think about, like, we talked about the quality of the protein, and in Illinois, most states have a WIC program, right? So slightly off, but I just wanted to speak to this. So I pulled up, my little version of what they're saying, right? And so what can we give people who are on a WIC program, that underserved population, rather they're in rural America or in the cities? Well, of course, they have, whole wheat grains and breads, brown rice, soft corn tortillas, oatmeal, cereal, all brands. I mean, if I started Frosty, Mini Wheats, and Kicks, and all kinds of garbage cereal on here, of course, the infant cereal for the babies, they got the milk's fine, yogurt's fine, cheese is fine. But the part that blew my mind was under the category of meat and beans. The only meat that's on this form, I see eggs, which is cool. And then it says canned fish, like, tuna, pink salmon, and that's pretty much it. So I want you to pause for a minute. The most nutrient dense food that we can give our babies are not even being offered if you're on the WIC program. Instead, they want our babies to eat cereal and all of this processed garbage. So I'm not sure where they get their advice from, but does that make any sense? So for me, we have to do better. And I would prefer, and I don't want to sound inappropriate by saying this, I'm more concerned about humans than even the environment. We need an environment to live, but can we focus on humans for a little bit and do what's best for them? And I just think that where we're arguing our case is a little backwards.
Yeah, and that's a really, and I've seen that before too, Tony. And it is sort of disconcerting to think that the people that most depend upon, the poor, underserved people of various, cultures are disproportionately affected, with not being able to access good nutrition. And it just puts them in a deeper hole because they're like,
Yeah.
I can't even get good nutrition, and it's going to affect my school performance, my ability to be a productive member of society. And so you're just kind of relegating these people to further and further nutritional problems, which is not going to help. And it's a shame. And I don't know who's in charge of the WIC programs for the various states, but it seems like you say, hey, look, we're harming these people by not offering these really nutrient dense
And,
foods.
and it's those guidelines, Doc, that are hurting us. Like I know Nina Teicholz would argue that we shouldn't have guidelines at all, but I think the problem, that's why the American Heart Association, American Diabetes Association, these Association of Clinical Endocrinology, them putting a rubber stamp, not necessarily saying they're endorsing it, but to say it's an option to do carb restriction is important because there are doctors within my health system I heard that think I'm a quack. I mean, I'm a regional medical director. I have titles. I literally chair the quality committee for our health system. It's like the 10th largest health system. So it's like I'm not like this, somebody just found down the street. But when it comes to keto, you're a quack. And so I need a little of the powers to be to at least endorse or accept or say it's okay, because I will not get some of my clinicians to move until they see that those organizations endorse it, because we are robots being programmed. They put a program in our hand, we just follow. And if it wasn't for us thinking outside the box, I'm sure Dr. Baker was a robot before he found his way. I was a robot, and I could even do the dance for you if necessary. I am not a robot anymore. I refuse to live that way. They trained me to think. I'm going to think. I'm going to question stuff. I'm going to challenge people, because if I don't do that, people will literally die. So totally, totally on the same page with you there.
Yeah, I mean, I was more of a machine. I was just cranking surgeries. I mean, I was just efficient moving like, like a NASCAR guy, boom, boom, boom. But at the end of the day, yeah, you're right. But just similar to the WIC thing, we've got this thing about New York City now. Eric Adams just elected mayor. He's a vegan, or something, sort of a vegan. He eats fish apparently, but he's now, in addition to the Meatless Monday that De Blasio put in place, now you've got vegan Fridays now. So what are your thoughts on those types of things?
Well, again, going back to what I shared with the WIC program, it's on the verge of just not appropriate to say to a family that they don't have a animal option. Now, if you say to me that you want to increase the availability of plant-based food in any environment, I would never argue that. I do have patients who don't tolerate animals very well, but to say it's required in America is a ridiculous statement. And then if you start, and that's why they need advisors like, people like myself, Dr. Baker, and others. You know, what's the nutritional value? So I saw some of the food they were offering, and when you look at the nutritional value, for some kids who may never, they would never get like 3 square meals or whatever, right? And they're getting it, but then you're giving them garbage. So I think so. Some of it is how I see the world as an American. I think that we should have choice. Even with I don't want to make this controversial, but even with the vaccine, I say, can we at least live in a world where you have to have an option between vaccine versus tested, maybe? I understand in certain environments like healthcare, but to just force people to do things, I've never believed in that. I understand population health and you have to do things, but I think people should be given alternative options when there's an alternative option. Sometimes you don't have it, that's fine. But I think that how we manage people's lives we have to relax a little bit and let people make some choices and explain why one choice may be better than the other.
Yeah, and, as a surgeon, every time I took somebody OR, there was an informed consent process, and
Yes.
sometimes, I would give people the option, what I thought was the very best option, and they would disagree, and they didn't want that. And I wasn't going to strong arm them into doing it. It's just not ethically appropriate to coerce people. So, I do think we had too much of that. Um, just back to the environmental side a little bit, there's some thought about, maybe we can raise animals in a way that's not only not harmful to the environment, potentially beneficial. And some people like to call it regenerative agriculture. Have you delved into that or looked into that at all?
Yeah, just a little bit. I mean, again, a lot of what I delved into is when Benny said, "We want you to be in this documentary." And I said, "Well, what are we talking about?" He was very vague. I was like, "Benny, what are we talking?" so, so when I got a feel for what it was, that's when I was able to learn more. And again, I appreciate Sacred Cow and the work Diana Rogers does because it really helps a clinician who may have. I'm not on a farm. I'm a city boy, right? So I live in a big city. My wife's from Mississippi, so I always remember the day she came home. Her dad sent her some sugar cane, and she was so excited. I'm like, "What are you so excited about?" She goes into the kitchen and she grabs a big knife. She just cuts it, you know, and she splits it, breaks it open, and starts sucking it. I'm like, "What are you doing?" So I got a little country in my home. I got a little city in my home, but not the kind of background that would make me understand regenerative farming. But what I did learn is that regenerative farming or regenerative agriculture is just a way to kind of connect with the earth in a way that allows you to focus on, you know, let's make sure it's biodiverse. Let's make sure that the water cycles are appropriate where you're using and reusing the water. You're just making it more. You're more concerned about the topsoil so that the soil is usable after you finish growing what you're growing. You don't disturb the soil as much as you do. Think about those big machines that are tilling and turning the soil. That's disturbing the soil in a way that's pretty significant. You may get erosion, nutrients that run off. So those are the things that come to mind. You're not using chemicals, so you try to raise the cow in a way that you're not having to use a lot of chemicals. You're not spraying everything the way you normally would. And I think the other thing I learned was that you're not using the same crop all the time, so you're kind of you're diversifying the crops, which is better for the environment as well. In other words, and you're using the cow as your friend. So, we go to the store and buy, like fertilizer, but we got a cow that can do the fertilizing for us. So how about if we let the cow do his thing, his or her, thing, and let them do it that way. So I just think that, and I don't know how easy it is to, I know that when Diana Rogers talks about it, she talks about you can't grow corn everywhere. There's hilly areas, so, but you can graze almost anywhere. So I think, and I don't think we'll live in a world where there's no factory farming. We just need to, live in a world that's a little bit more balanced and that we make it okay for a small farmer to do it the right way and be adequately compensated. Do we really need to keep, subsidizing things that are not adding value? I remember when I wrote my first book, I learned about Nixon and how he had to, in the nature of feeding Americans, which I'm okay with, but we're still subsidizing things we shouldn't be subsidizing: corn, wheat, soy. We shouldn't. We're probably still subsidizing the oil industry, but that's another conversation. So we gotta reevaluate and then say what's the need. Look at the science and then move in that direction. So I think regenerative farming is a great way to achieve that, and I'm really excited that we have people who are messaging that. And I think when people start to hear that term, they'll say, "Well, what the heck?" Just like I use the term metabolic health, we should be using terms that people are not familiar with, so they can understand what that means, and then they can make changes so they can move towards those goals.
We talk a lot about, we like to show like this patient got off these medications and stuff like that. But as a physician, how different is practice these days? I mean, how much more happiness do you get by deprescribing? I mean, this is not something you're taught in medical, how to deprescribe it. Now all of a sudden you're like, probably, I'm taking people off meds. How good does that feel as a physician to do that?
Yeah, I yesterday I took two people off of their medicine. One of which was a blood pressure medicine, and she asked me 3 or 4 times, "Are you sure? Are you sure?" I said, "No, your blood pressure is 114 over something. Some days you get lightheaded. I'm very sure." So it is. It's almost impossible to help you understand what this means for me. So I you already work crazy. It's like, being a doctor is like being a pastor, right? Doctor, you need to get more rest. You say that to the pastor, right? But then you say you can get more rest after you go to the hospital and see my family member, right? So that's how people think. It's like, I want you to be okay after you take care of me, right? So I've learned that when I walk into the office, people already know what to expect. I'm going to be asking them about diet. And for anybody who's a clinician, your return on investment is incredible. So if you only prescribe the lisinopril and the statin, you will never see them heal. But imagine if you carved out 5 of the 15 minutes or 5 of the 20 minutes, and you're just giving them basic advice or saying, what's that one thing you're willing to give up? You will change their life and generations after them. So I literally feel warm and fuzzy. Literally, at least if I see 20 patients, I see up to 25 patients, right? At least 5 of them are celebrating something. On a good day, it's like a little bit over 10. I can't put into words what that feels like. And just to put it in perspective, I've been practicing, I'm 53, I've been practicing for 29 years. In those, if I go back 9 years before I did low carb, I can count on one hand the number of people who get off meds. It's a daily, if not, I'll give it every other day, somebody's getting off meds. And it never happened, right? So they think I'm like walking on water when people are referred to me or they find me on my YouTube channel or whatever. And I'm not doing anything special, only I just carve out time to impact the people who I serve. Now, what disappoints me, Dr. Baker, is I share a lot of this stuff on social media. I did the obesity lecture talking about carb restriction for our health system. I did 2 of them. I did the lecture for our health. We have 10,000 docs right now. We only are going to have a couple hundred doctors on the call, or we call it med talks. But there's only a fraction of doctors, even after hearing this, that leave that conversation and change. That's the part that perplexes me. I can't understand why more clinicians, and I'm showing them success stories, I'm showing them the studies, where I'm sharing the last one I did talked about the therapeutic guidelines for carb restriction. You'll find on Low Carb USA and on the Society of Metabolic Health Practitioners site. Shout out to our leaders there, Pam Devine and her husband. But it's like, I don't understand why people don't recognize that what you're doing hasn't really moved the needle, and maybe you should think about doing something different. So again, that goes back to what I said. Now people have permission to do it. Maybe they heard the story and they were so afraid. And guess what? This is the part you have to understand, guys. I get dinged every time I don't put a diabetic who's over 40 on a statin. I make less money. That's my reality. Now, and I shared a video on YouTube recently about the American Heart Associations and how they now are saying, of the heart tests available, a coronary artery calcium score test is the best risk stratification test you can order to predict a future heart attack. And in our health system, it only costs $50, right? So now, if they are diabetic, the studies show that 39% of diabetics don't even have to be on the statin, even though they've been asked to be on one. Because if they have a 0 score, there's no benefit of being on a statin. So what we need is we need these types of organizations to say this out loud. And then we have to get our health system and the insurers to endorse it. Because if the Heart Association says it and they don't change, we're going to still have 39% of the population taking a statin. Oh, it can increase your risk for cognitive decline, or you can increase your risk for things like diabetes. So we want to start having these honest conversations and not be married to these corporations that are only trying to make a profit.
Yeah, and I get a lot of people that complain, they approach their doctor about a coronary artery calcium scan or fasting insulin. The doc says there's no reason to do it. I don't want to do it. They give a lot of pushback for that. And I think it's kind of, I think it's frustrating for the patients, but
They don't know. I honestly think I really have to believe, I trust my colleagues. They have not looked at the studies. Do you honestly think, Dr. Baker, before I started doing a master's in nutrition, but I think the low carb community is where it started, because you're on Twitter and you have to justify your opinion, right? So I had to look up stuff and I had to go past the abstract. The doctors are not doing that. And if you think they are, you're mistaken. What they do is they hear the headline on CNN and it's not moving them in an evidence-based direction. And they basically are no different than the patients that they serve. And we really should have a higher standard, than the person who's just watching CNN who doesn't have all of this educational background.
yeah, one of the things, with physicians, and I mean, honestly, I, unless I figured out my own health, like I got to be about 42, 43, realized my health wasn't going to was. I did my own legwork for myself. But until I did that, I was still the robot. I didn't even think nutrition mattered. I mean, if I look at my orthopedic textbook, there's zero mention of nutrition regarding any condition I would treat. And so it's kind of like, other than, maybe somebody's cachectic and you try to get their albumin up. But I mean, there's really no literature on that stuff. And so do you think of
Yeah.
physicians, they basically have to go through their own personal, experience before they convert? I think that's what the deal is, maybe.
Yeah, and the thing, I do not make this up. I think it was yesterday. I had a patient who had lost about 25 pounds, restricting carbs, and I asked her about her knee, and this lady complained about her knee every visit, every time. And we kind of got to a point where I don't want to do anything for it, so we'll just have to live. And I was doing things like, turmeric or, things like that. She came in during this visit. I mentioned her knee. She was like, "Oh, my knee hasn't been bothering me." Like, so what people have to like, I remember interviewing, and it's like shocking, to be honest with you. So, and let's be cautious about this comment. Like, if you got bone on bone, there's a point where it's structural. You gotta have a knee replacement. Let's keep it real, right? That's why we need Dr. Baker in the world. But man, I learned from Dr. Gurpreet Pada, who I did an interview. If you want to see that interview, it's Padda, Dr. Gurpreet Pada and myself on YouTube, right? And he's a pain and addiction doctor, and he has board certifications, all this stuff, right? And he said you can't fix pain until you fix inflammation, and the way you fix inflammation is through lifestyle. And so it's not just the weight. He suggests that it's more the inflammation. So yeah, the weight loss helps. So what I tell patients, you want to do all the things you can do. Reduce stress, make sure you're getting sleep, make sure you're eating well. And if you do all of these different, make sure your relationships at home are healthy, because if you're stressed every time you go home, you're probably going to be in pain. So you have to think globally about all of these factors, figure out where you have gaps, and then work on those gaps. And so in order for Dr. Baker to do a good job as a surgeon, he needs patients who are engaged in lifestyle, make his life, and it's much safer, I'm sure, to do surgery in a person who will heal better because they're not eating inflammatory foods that may make the healing process not go well.
Yeah, it's amazing the effect that diet has on our joints. I used to think, 10, 15 years ago, I had patients would come in and say, every time I eat some food, it hurts my knees. And I thought they were kind of crazy because I didn't believe that stuff. And then years later, I'm the biggest advocate for that because I see how much an impact it has on joint health. There was a study out of University of Alabama comparing low carb diets to low fat diets and knee pain. And they clearly saw that a low carb diet had a tremendous beneficial effect on knee pain. So that's out there. That's already in the
Yeah.
literature.
Yeah.
Yeah.
I believe that.
Where do you think, Tony, where do you think the future is? What do you think about the future? Where do we
Woo. I'm naturally an optimist, so let's start with that, right? Like, I believe that the world will be a better place in the future, regardless. I laugh at people that say, because we're in a war right now, and Will Smith slapping people, Had to throw that was a freebie. I threw that in for free. I'm actually gonna make a video about that, probably record it today, and just put my thoughts on that on YouTube. Hopefully tonight or tomorrow. But I don't know that I'd want to be in this country 50 years ago or 100 years ago. I think that things are getting better. We have more technology. We're learning more. We probably wouldn't be doing this carnivore keto stuff if it wasn't for learning more, right? So I think the first thing is that we're doing okay. Things will never, all of us will disappear from this planet and the world's still going to be crazy. So that's okay. That's just the nature of human beings. But I think it starts with education, because if you think about it, most of what we're doing now is education, create awareness. That's the first thing. We need more documentaries like Benny's to balance the other end, and we try to do the best quality as possible so people can, stand on the arguments. We need people like myself, Dr. Baker, other people who are kind of influencers to keep doing that. And some of us will make this a full-time thing, depending on the situation. I'm personally staying within a health system because I like the idea. They do listen to me. Like, we started an obesity program. We had we're going to restart this, a healthy living program. So we get in front of 200 people and we talk about wellness. Next week, we have a COPD class. It's virtual like this. I'll do a lecture in my COPD class. It's focused on lifestyle. So we need health systems to create programs. We have a food pharmacy that I help lead. So we partnered with the Chicago Food Depository. And in that partnership, we didn't just say bring food and we'll give it out. What we did is, what do you have? And we need cauliflower. We don't want the corn, the potatoes and the corn. So what we did is we tweaked it so that it would match. And then when people come see us, before they actually get the food, they got to tolerate me and me teaching them. And they have to, and then I'll give them recipes. Here's the cauliflower. This is how you make a mac and cheese using cauliflower. And things like this. And by the way, when you make your ribs, do not put Sweet Baby Ray on that. So what we do is we teach and teach. And shout out to Sweet Baby Ray. I hope you make a good living, but it won't be at my expense. So those are the things we do. And so that's the general theme. I think the research piece is really important also, Shawn. That's why I really hope and pray you're able to do a good job in that space. Again, I plan to do the same. And then I think this ideal of how we have a conversation. I know we get a little, we go back and forth on social media. I love the little post that you recently. It's so funny. So you guys may have seen that post where it had our Microsoft leader compared to ShawnBaker. I can't remember, some guy, keto somebody. I liked it and shared it because I thought it was cute that you're asking me to eat an Impossible Burger, but yet you don't look like you're the healthiest guy. And they contrasted that with our very own ShawnBaker. So I think research and then being comfortable with the term metabolic health. So truth be told, even though I argue back and forth with the vegan community, I would prefer that we can sit at the same table. Now, on Monday nights on Facebook, there's a vegan, Dr. Terry Mason, who was in, I think, Fork Over Knives. So I'm sitting in the same platform, and some of those videos are on my channel on YouTube. And we're sitting next to each other, essentially. And so I think we want to be able to have an intellectual conversation. We just agree to disagree. So when I presented the information that it's okay, low carb is better than low fat, he just agreed to disagree, and that's okay. But I did present evidence that clearly you couldn't argue against. So that's the world I want to live in, where we can work together and where we focus on educating the public and give them permission to make the decision that's best for him. So it's that bio individuality approach, Dr. Baker, where people are given information. And because some people, again, can eat meat and it's great, that's me. Other people eat, vegetables and that's great. They don't tolerate. They say, "Oh, I can't digest meat," whatever. And there's really reasons for that we can explain. Maybe you're not making enough acid because you haven't had to make. I mean, we can fix it, but I don't argue with people. I just say, okay, fine, we'll just do this. As long as your metabolic markers are okay, all the things we worry about are okay. And if that's okay, then do what works for you.
Yeah, I think that's a great philosophy, and I think the commonality when we look at people that have success on plant-based diets versus animal-based diets is we all kind of eliminate all these ultra-processed junk foods, and the other side won't concede that that's the problem. They're still ideologically bent on, saying that meat is evil. Tony, unfortunately, I have to go, but tell people where they can find you, and thank you for continuing to advocate and doing a great job because you're a really strong light in this world that we needed in places
Well,
like where
thank
you're.
you. Thank you again for the opportunity. Because one thing I will say, guys, the low carb community has opened their arms to me. And I just want to thank all of you guys, even the people who are here as, just following Dr. Baker. So I want to say that out loud. I do want to say, consider checking out the documentary Beyond Impossible. For me, it's linked. I learned about Linktree, right? So if you just type in Linktree, Dr. Tony Hampton, you'll see all the stuff I shared. You can just Google that and consider the YouTube channel. I don't have the courage that Dr. Baker has yet, where he just gets in front of the camera in the car. I need to start doing that, but the YouTube channel is what I'm focused on because in the communities I serve, people are not doing podcasts, even though I have a podcast. So I put my podcast on YouTube and in the podcast app. So I would look that up and support that, and then comment and share your thoughts so that we can get more people to learn this information.
Thanks, Tony. Appreciate it. If there's anything else we can do for you, let us know. It's always wonderful talking to you. Keep up the good work. The rest of the folks will be back tomorrow. Like I said, got to run. Thanks, everybody. Bye bye, Tony.
Take
Thanks.
care, guys. Have a great day, guys.